single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand for New York.
Welcome to this week's edition of New York Now. I'm Elise Klein. The final state budget totaling $254 billion has officially been signed into law. Following the governor's conceptual budget agreement announcement at the end of April, lawmakers took about a week to finalize budget bill language, print the bills, and start voting. Legislators debated and voted on budget bills for a total of 2 days. Both chambers wrapped up voting late last Thursday night. On the floor, the Senate Majority Leader said this budget season was particularly challenging because of potential cuts at the federal level.
In this budget, New York has made a choice to stand with working people and to invest in people. We've decided to strengthen our schools and our hospitals, not to starve them, to expand access to food and housing and not rip it away. And while Washington continues to take more from New York than it gives back, we'll keep doing the work. We'll keep investing in people, and we'll carry that responsibility forward when we leave this chamber today, because that is the promise that we make to every New Yorker.
The governor signed the budget bills into law the next day. The finalized budget comes more than a month after its constitutional April 1st deadline, making it the latest state budget in quite some time. Policies like involuntary commitment, discovery reform, and cell phone ban in schools were primary elements pushing the budget into overtime. In this next segment, we dive into the mental health crisis in the state and how it impacted the state budget this year. In Albany, state lawmakers have many mental health priorities, but so far this year, they have spent a lot of time focusing specifically on involuntary commitment. Governor Kathy Hochul first proposed this issue with a policy change to involuntary commitment laws during her executive budget proposals this year. The governor wants to make changes to existing policies like Kendra's law. The change would allow individuals to be involuntarily committed if they are at significant risk of physical harm when their mental illness prevents them from being able to meet basic needs such as food, shelter, and medical care.
This is about showing humanity for fellow human beings who are suffering from mental illness that is literally putting their lives and perhaps the lives of others in danger.
Some state Republican leaders agree with the governor's plans, saying the state has moved towards a deinstitutionalized setting.
We have turned our backs on the mental health system here in New York. We have let it atrophy, decay, dismantled, whatever term you want to use. And when we talk about the increases in crime and the increases in instances of crime, a lot of that, homelessness, a lot of that can be traced back to mental health.
Bridget Gannon, a psychiatric nurse practitioner supportive of the policy, says there are limitations within the system. She says the limitations do not allow New Yorkers to get proper treatment for mental health disorders like schizophrenia.
I think we are not doing a good job. We're failing as a community, helping people that really are having acutely psychotic episodes getting the help they need.
However, some Democrats and many mental health advocates are outraged by the governor's proposal. They argue the proposal would criminalize and exile individuals struggling with housing and/or mental health challenges rather than address their needs. Harvey Rosenthal, CEO of Alliance for Rights and Recovery, says it's problematic to focus on police approaches.
So the way it's set up, the police would be, who are not trained to make these assessments, would make an assessment of someone who's struggling and say, A, they have a mental illness, and B, being in a psychiatric hospital involuntarily is going to not only stabilize that, but help them get food, shelter, and clothing. Hospitals don't give out food, shelter, and clothing, and people can be stabilized in non-medical, non-hospital facilities, which the governor has funded.
Bruce Lowenkron, the director of disability justice at New York Lawyers for the Public Interest, says the governor and lawmakers shouldn't legislate based on isolated incidents.
And where we as advocates together say that she is confused is in suggesting that it is people with mental disabilities who are causing the unrest, who are causing that public safety concern. It's simply not true.
Lowenkron adds data demonstrates people with mental health challenges are no more likely to be violent than people without those challenges. Lowenkron also highlights data showing involuntary commitment to be ineffective. Assemblymember Joanne Simon, a Democrat representing parts of Brooklyn and the chair of the Mental Health Committee, says lawmakers and the executive office should look at the failure of New York City's recently implemented involuntary removal directive.
I think the fundamental problem I see with the proposals this year is, for the most part, the emphasis has been on something that we know to not be terribly effective, that we know from at least the biggest pilot that's been run on this in New York City, not effective.
According to a report from the New York City Council, the 2022 directive undermines support for mental health programs with evidence of improving outcomes. The key findings showed stark racial disparities with the policy and a lack of data demonstrating the practice's effectiveness. It also showed a disconnection to long-term care and an abuse of power, more often removing people from private residences than public spaces. New York State Office of Mental Health Commissioner Dr. Ann Sullivan argues against some of the existing research.
I don't think there's any good research on one particular one way versus the other, but it's important, I think, to note that just as there's anecdotal individuals who will say that this didn't help, there are tons of anecdotal individuals who say, thank you for helping me because I really wasn't able.
Gannon says she has seen firsthand the need from families who want to get care for their loved ones who aren't able or willing to help themselves. Gannon also emphasizes protecting patient autonomy is incredibly important, saying the Nurses Association doesn't want to see any disruptive changes to the current standards of Kendra's law. The law, which was enacted in 1999 in response to the death of Kendra Webdale, who was pushed in front of a subway train by a man with a history of mental illness.
Yeah, you have to determine two things: whether or not they have the capacity, the medical decision-making capacity to decide whether or not they can go to the hospital, and also whether or not they're at acute risk of hurting themselves or others. And we are not asking to change those professional standards. Again, they're incredibly important in terms of protecting patient autonomy.
Some lawmakers say they need to shift their focus away from this particularly controversial issue. Simon says they should instead focus on filling in the gaps when it comes to challenges within the state's mental health services.
We need to provide the services, we need to provide the staffing, and we need to provide the access to supported housing.
Glenn Liebman, the CEO of the Mental Health Association in New York State, agrees, saying lawmakers should be putting funding towards staffing and community services.
I think that's where we need to go, because if you force people to treatment, ultimately, if there are no services there, what's going to happen? They're going to go back into the system and eventually, end up back again in the hospital, in crisis services, in prison, in jails, or homeless. We have to make sure that those services are in place for them.
Liebman says his top priority as an advocate is pushing for an increased cost of living adjustment for the workforce. He also stresses the mental health workforce is in crisis right now.
We continue to lose staff to other entities. We can't pay a great deal of money because we don't have a lot of money. So essentially what happens is that people in our field end up going to the Walmarts, the McDonald's, the Amazons, because we can't keep them.
Liebman and other advocates are fighting for a 7.8% investment in the cost of living adjustment, or COLA, which they say hasn't been substantially funded in about a decade. Liebman says if funded to a 7.8 increase, the COLA will help stabilize the mental health field. Mary Sidnor, the director of the residential treatment facility at Parsons Child and Family Center at Northern Rivers, says keeping good workers is a continued concern.
I worry about myself. I worry about my staff and whether they're going to be able to, because that's more on me if I can't retain my good, talented staffs.
Sidnor adds that good workers improve the quality of patient care.
It impacts every part of the program when we lose good staff, and we want to be able to give them quality care.
Simon says lawmakers in both houses support increasing the cost of living adjustment.
It doesn't matter how many beds you have if you can't staff them.
State Senator Anthony Palumbo, representing parts of Suffolk County and a ranking member of the Mental Health Committee, says the workforce is the backbone of the industry.
So mental health needs to always be a priority. And the fact that they've been underfunded for so many years systemically, that we need to really make up that difference, because we need to make sure that they have the workforce to address the needs that are necessary.
Sullivan says the workforce is vital to the needs of mental health services. She also says addressing these challenges requires a multifactorial approach. She says one other way to help the workforce is to incentivize education.
So one of the big things that we have is a loan repayment program. And the loan repayment program provides loan repayments now for psychiatrists, nurse practitioners, social workers, psychologists, certified mental health counselors, the entire mental health workforce. And currently, we have had almost 1,000 individuals pick up that loan forgiveness program, which means it's 1,000 individuals who have now getting loan repayments, but have committed to work a minimum of 3 years in the public sector system. So that's tremendous.
The commissioner also says support for helping the workforce is growing.
Mental health services across the nation have always been in short supply in terms of being able to be there to serve people. But I think we're getting a lot of support.
The commissioner, along with lawmakers, workers, and mental health advocates, are also hoping to see an increased support and investment in peer support services.
But we need more and more peers in the workforce. They are a tremendous impact.
Gannon says peer support is incredibly helpful for people with mental health challenges.
I've seen it firsthand that peer services work really well, and we certainly need to invest in more peer resources.
Sullivan says one of the ways the state currently provides peer support is through intensive and sustained engagement teams, or INSET teams. Sullivan says access to these services is most beneficial via insurance coverage. She says this is an area where she'd like to see the state expand.
It's growing. There are some commercial payers who will pay, Medicaid will pay, but it's critical that it be a service that's available for individuals, and you make it most available often when you have insurance coverage.
Some lawmakers say another way to address mental health needs is through a rural suicide prevention council. Simon says lawmakers need to find a way to prevent suicides and help New Yorkers with limited access to resources in rural areas.
They just have a real lack of access. And so why is this a problem in rural communities? What are the things giving rise to it, and how can we address this?
The bill to establish this council has bipartisan support and passed last year in both chambers. However, it was later vetoed by the governor. State Senator Pam Helming, a Republican representing Ontario, Wayne, and Livingston counties, and the lead sponsor of the bill, told WMHT she was confused by the governor's veto.
I was floored. I didn't understand the reason why, and she vetoed it in a stack with other bills. So it's still not clear. There was some talk about the fiscal impacts of the bill and that it needs to be done through the budget process. However, the bill creates basically an all-volunteer task force, so there really isn't significant or substantial funding that is necessary or needed.
Helming says the bill, if signed into law, could address barriers in rural areas that often don't get the same attention as larger cities in the state.
This bill would really help us drill down and pinpoint what is standing in the way of people living in rural communities getting the services that they need.
Helming says the bill passed last year at the end of session, so she is optimistic lawmakers can get it across the finish line in both houses once again. Lawmakers have about a month left before they adjourn the legislative year to get bills like this passed and other mental health policy measures. The final budget language amended the state's mental hygiene laws, making small changes to definitions such as in need of involuntary care, of treatment, and the likelihood to result in serious harm. The budgetary changes are in line with what the governor wanted, allowing individuals to be involuntarily committed if they are at a risk for serious harm. The budget changes also include pieces of what lawmakers wanted, ensuring continued care. This includes discharge obligations such as requiring reasonable efforts are made to promptly notify any community provider or mental health services that maintains the individual on its caseload. In addition, the language also requires the facility to advise the individual of clinically appropriate aftercare services and, for individuals with complex needs, coordinate discharge planning with the care management program and provide referrals to community services such as resident programs and peer-based programs. And for more information and resources on the final state budget, you can visit our website. Again, that's at nynow.org. Now that the budget is finished, state lawmakers plan to continue their efforts to push for their varying priorities. For State Senator April Baskin, a Democrat representing parts of Buffalo and a new legislative member, that means prioritizing addressing pay disparities. While the state and the nation have made some progress on closing the wage gap, Senator Baskin says the work must continue. We sat down with the freshman state senator to discuss what pay disparities look like across the state currently and what kind of progress is being made in Albany. Here's that conversation. Thank you so much for joining us today, Senator.
Thank you for having me.
So can you start by telling me, what does pay equity look like today, and why do you think this is an important issue that needs to be addressed?
Well, it's definitely not balanced. The National Census records definitely showcase that women make 80 cents for every dollar that men make. And I think that that is a reflection of family care burdens that we traditionally see women having to juggle. So we still do have a far ways to go to reach that gender parity when it comes to pay. I do believe we are light years from where we started, 60 years ago when the first piece of legislation was introduced to kind of address pay equity nationally. But like all things, when you're trying to reach a goal of equity and fairness in a community, it could take decades.
And the state does have pay equity laws that were expanded in 2019, yet, as you were saying, women do still make significantly less than men do. Why do you think this issue continues to persist, and how can the legislature here in Albany address that issue?
Well, I think it's to continue the legislative process. When you look at things like paid family time leave, which has been recently introduced in the state legislature, and that encompasses not just natural newborn babies, but also fostered children and children who have been adopted. I think that definitely helps ease the pay equity lens and any fiscal burdens that may come along with having to miss work because you have to provide and care for a child at home. There's a piece of legislation recently introduced in the past years that requires employers to actually list with job postings what the pay is. And that is so that when you are being interviewed by someone, your gender does not determine your worth. I think that we are on the right trend in New York State. We tend to always trend above the grid when it comes to developing robust legislation that will help shift society towards a pathway forward. And I think that going to the drawing board and continuing to explore ways where we can concretely introduce laws that will help limit the discrimination against women in the workplace when it comes to their paychecks.
And there was a 2024 report from the Department of Labor which shows that the wage gap continues, especially for women of color as they experience this at a much higher rate. I'm wondering what you thought of the report and what it could demonstrate in terms of what could be done here in Albany.
The report is, of course, disappointing. Being a woman of color myself, a professional, I am a single mom, so I have a single income household, 2 children. So yes, anything that deals with disparity in gender, when you add a racial lens to it, you are going to see a further disparity. So as we see women making less than men, you can almost be rest assured that Black women, Latino women, and women of indigenous backgrounds are making even less than white women. So that is troubling, it's disappointing, and it's something that has to be prioritized in the state legislature.
And the report also showed that New York is one of the few states in the nation that has one of these smaller wage gaps. I'm wondering, do you think this points to a sign of progress at all in terms of this issue in the state?
Well, like I said before, I find New York State to be the greatest state in our country. And we do find that we are always leading and trending at the forefront of change. I think it is a good thing, of course, that our gap is a bit smaller as reported in that document. But, when you think of the grand scheme of things, I think it was Dr. King who said an injustice anywhere is an injustice everywhere. So we really do not have room for any form of disparity or the tipping of the scale in that space. So I'm excited to be a new member of the legislature, a person who comes from a marginalized background and who lives on a fixed income, who's raising a family on a fixed income, because I think it is adding my voice and my lived experience to that conversation that is going to get New York State to where it needs to be, which is an equal playing field for women.
And there's another report from Cornell that was showing that in your county, in Erie County, there seems to be an even greater wage gap where women are earning significantly less than men are. And I'm wondering, how are you feeling about where the workforce is right now in terms of this issue?
Well, that's to be expected. I think there's a lot of transition in Erie County. I've been an elected official in Erie County now for going on a decade. I'm in my 8th year of public service. And there's a lot of governmental leadership transition in Erie County. There is severe economic development transition in Erie County. Erie County is really right now booming with new construction projects, as evidenced as our new Bill Stadium. And so, I was at the forefront of that negotiation, and one of my claim to fame as a leader is being very vocal that there needed to be a community benefits agreement affiliated with that construction project, once in a generational construction project. We won't see anything like that again in our region for decades. And so one of the things that was very important to me in that community benefits agreement was to make sure that marginalized groups like women were prioritized. They were mandated to be utilized, not just in construction, but in post-construction of that deal. So when you look at the community benefits agreement for Erie County's new Bill Stadium, you will find that women concessionaires, women vendors, women suppliers, the women who own these types of businesses are actually mandated to be prioritized, and there has to be spend with them according to that agreement. As communities begin to transition and as they trend a certain direction, be it the education system, be it fields in the medical field, or like what we're seeing right now in Erie County, a lot of new construction and affordable housing development. It's important for us to always keep at the forefront an equity lens when we are cutting those deals, especially with the private sector. So I'm very proud that women will not be left behind when it comes to making a dollar on that new stadium project. And that's the kind of work that needs to be copied and pasted across the entire state.
And groups like the United Auto Workers are also fighting for pay equity as well as better wages and a safer workplace. What kind of measures are in the legislature at this moment in terms of policies, active bills that are going to achieve those goals?
Just a month ago, I had the privilege of joining the UAW here in the Senate, and they held a weekend event with their legislative agenda, and there were several things on their legislative agenda that didn't even really relate to auto workers. It was just about they have a strong legislative agenda this session that is very much focused on equity for all workers, educators, people in the medical field, and people in trade industries like themselves. So it was very inspiring to see so many women a part of that union, standing up that weekend, standing beside them and advocating for them to have safe work environments. So I know that they are trending in the right direction. I have a great relationship with them, and I'm going to stay close to their legislative agenda because it does align with making sure that women and people from all marginalized backgrounds have the resources that they need to be treated fairly in the workplace.
And with a short period of time left of legislative session, what are your next steps here on this issue? What are your top priorities?
Well, I always encourage people to use their lived experience to drive in the direction of change. And so I think long and hard about all of the times in my life that as a woman, as a mother, and as a Black person, that people have looked at me differently, that people have doubted me, that people have underestimated me. And I think about those caveats often, and that's what inspires me to create and craft new legislative policies. Right now, we are dealing with a very, very, very sensitive political climate in our country. And I think far too often people are distracted by things at a high level and not realize how they impact people within the confines of their own home, the dinner table, their bank accounts, right in their pockets. So, being somebody that comes from the same city that the first mom governor of New York State comes from, first woman to ever be governor of the state of New York. I'm proud to be in Albany and to advocate and to push hard for policies and change in this space. Because if we don't do it now, if we don't do it with the first woman governor of this state, if we don't do it with April Baskin in the state Senate, the first Black woman from her city to ever ascend to the state Senate, this kind of work won't get done. So I'm ready to strike, while the iron is hot and to seize this moment.
Well, thank you so much for taking the time to sit down with us, Senator. Unfortunately, that's all the time we have for today.
Thank you. Thank you for having me.
And we were speaking with State Senator April Baskin. Lawmakers have only a few weeks left before the legislative year comes to an end. For more information about lawmakers' legislative priorities this year, you can visit our website. Again, that's at nynow.org. Well, that does it for this week's edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,